Right, we'll go ahead and get started. It's 11:30. Thanks for being here for our Wednesday COVID-19 media briefing. Today we'll have District Health Officer Kevin Dick, and then we'll have Q&A after he's done with his update. So Kevin, if you're ready, please go ahead.
Yes, thank you, Scott, and thank you, everybody, for joining us today for the media briefing. I'd like to start with our situation report with COVID-19. Our 7-day moving average is at about 116. And what we've seen happen over the past week is that that number, the 7-day moving average, is kind of flattened out. And it's stayed in about 110 to 120 new cases per day range. So we've been seeing some pretty significant decline in the new case numbers. That does seem to be flattening out a little bit, but we're hopeful that we'll continue to see that number go down as people are practicing the precautions of wearing a mask, washing their distance, and washing their hands, as well as the effects of the governor's pause and the reduced occupancy of 25% in the casinos, restaurants, and bars. Yesterday, we had just 41 new cases that we reported. We know that these numbers vary from day to day, but that was the lowest number of new cases that we've reported since October 10th. So just I think goes to show that when people are all working together to combat the spread of COVID-19, we can be successful in this. And we have been able to drive the numbers down here in Washoe County. What we're seeing coupled with that is a decrease in the positivity rate from testing. We've seen a lower demand for testing occurring in Washoe County. But while the number of people tested has gone down, the positivity rate has also gone down. I believe we're at 11.6 today under the state's tracking system, and that's down over 5% just in the last couple of weeks from being up much higher. So the message is we are succeeding in reducing the cases, and we need to continue to be vigilant and try to drive down those case numbers even more. On top of that, we are administering the COVID-19 vaccine. At the health district, we administered 586 doses yesterday. Those were primarily second doses that we were dispensing, and also another 580 second doses are scheduled to be dispensed today. The state did provide us with some statistics on vaccine administration. These were from January 27th, and so they're a little bit dated, and we think that the data in these numbers is also lagging for a few days from the data entry after people were vaccinated. But with those numbers, we had 7,732 seniors in Washoe County that had been vaccinated. So we are still in the 70 plus age group, and I know we have a high demand of people that do want to be vaccinated. So we're encouraging them to be in touch with the various folks that are dispensing in our community. Those are available on our website with links to contact them. But we know that Smith's and Walgreens are dispensing through their pharmacies, and Renown, St. Mary's, and the Community Health Alliance are also vaccinating seniors. In fact, I was over at the Community Health Alliance pod to see how they're doing their dispensing earlier this morning, and they had 120 people, I believe, scheduled to be vaccinated there this morning. We also got some information from the state's data that they provided to us. Again, this is a little dated. That is that of the vaccines that have been administered to date, only 11% of those had been identified as having gone to Hispanic and Latino populations. So we'll continue to work to try to make sure that we have vaccine available as it's available, dispensed equitably in our communities. But I also wanted to make sure that everybody understands that one, the vaccine is free. We don't collect any information related to immigration status. And you don't need the health insurance since it's free as well. In addition, the federal government has put out an announcement that they don't want ICE interfering or using any of the vaccination locations in their activities. And so I want to encourage everybody in the community, and particularly the Latinx community that we know has been disproportionately impacted by the pandemic, to take advantage of the opportunity to get the vaccine when that becomes available to you. And please understand it's free, and there's no questions asked about immigration status in that process. The other thing I wanted to touch on today is we do have Super Bowl weekend coming up, and that's traditionally a time that people get together and enjoy each other's company and watching the game. And we also have the Lunar New Year that's coming up on February 12th. Again, a time that people get together for gatherings. So while our numbers have decreased, they are still quite high by all standards. And we need to continue to be vigilant to try to get those numbers lower. I think we should be striving to at least get down to less than 10 cases per 100,000 population as we continue with our efforts to reduce the spread of transmission in our community. And right now we're closer to 25 per 100,000 population. So it's important for people to continue to practice those precautions and avoid the gatherings so that we can continue in our progress of reducing the spread of transmission. And I think that's especially important now that we know that we have additional cases of the UK variant that have been identified in Clark County. And now I think it's 32 states that variant has appeared in nationally. That one has the potential for increased transmissivity. And so we want to be very careful that we don't have that contributing toward another surge here in Washoe County. So we need to be protective of that. And then also the South African variant has been identified in the United States as well. So the variants just provide some additional complexity on top of all of this. I guess then I'd end with a sad note, and that is that over the weekend, tragically, we exceeded 600 deaths from COVID-19 in Washoe County, and we are at 604 people that have passed away in Washoe County from COVID-19. And it was less than a year ago, in early March, that we had our first case of COVID-19 in Washoe County. And I don't think anybody really imagined the magnitude of this at that point, and that we would be talking about over 600 people that have passed away in Washoe County from this disease. And we still have deaths that are occurring on just about a daily basis from COVID-19. So we expect that number to continue to climb. So with that, I'll turn it over for questions, Scott.
All right, thank you, Kevin. If you have any questions, feel free to shout them out. You can also leave them in the chat and we'll read them out loud. Please go ahead.
Hello, my name is Brianna and I'm a reporter with the Review Journal. Hope you're doing well this morning. I had a question about long-term care facilities. State said that the counties would be handling the clinics for facilities that didn't qualify under federal guidelines. I was wondering what you could tell me about what Washoe County has done to get the vaccine to those facilities that didn't qualify under the federal guidelines.
Yes, thanks for that question. So first of all, the majority of the long-term care facilities are handled separately through a federal contract with CVS and Walgreens that are vaccinating the staff and the residents in those facilities. But there are a few facilities that were not part of that program. And we've been partnering with Safeway and their pharmacists to be able to provide them with vaccine. And they're going out and dispensing those vaccines in those facilities to be able to get the staff and residents in those facilities vaccinated.
When did they start doing that?
I think it was probably 3 weeks ago, but I can have Scott track that down and let you know.
Okay, thank you.
Hi, Shaditi from This is Reno. I have a question regarding clarification about what does it mean when it says vaccine initiated and vaccine completed? If you could explain that for me, please.
So, Sudeep, I don't think we use those terms here at the health district. We report on first and second doses of the vaccine that are administered. But I would suspect that the vaccine initiated means that a person has that first dose of vaccine in their arm, and vaccine completed would be after the second dose is administered.
Okay, well, thank you for that. Then just to follow up on that, so it seems like the difference between vaccine initiated and vaccine completed is about 30,000. So about 40,000 people had like the vaccine initiated, and about only like roughly 14,000 people had their vaccine completed. So maybe could you shed some light on these numbers? Why the difference and what are the factors?
Sure. I think the primary factor is just when the vaccine first became available. So after somebody gets their first dose of vaccine, then if it's the Moderna, they have to wait 4 weeks, 28 days until they get the second dose. And if it's the Pfizer, they have to wait 3 weeks, the 21 days until they get the second dose. So there's a lag that's built in where we started doing the vaccines, and we had for the first 3 to 4 weeks, people were getting their first dose of the vaccine. And then it was only after those first 3 to 4 weeks that we then were able to start doing the second dose based on whether it was the Pfizer or the Moderna. So there's going to be that numerical lag between when the first and the second doses are administered, just because of when we were starting from a standing start, and then we had to wait that time period before the second doses could be administered. But I'd like to follow up on that with something else that I think it's really important for everyone in our community to understand, and that is how important it is to get back on time to receive your second dose. We are dispensing large numbers of vaccinations through our pod, and other partners are also working with the way they're scheduling their staff and their pods for vaccinating people, counting on if you get vaccinated today and you're getting Moderna, 28 days from now, you need to come back and get your second dose. Everything is scheduled around that, staffing, the vaccine, even having the right, whether it's Pfizer or Moderna, we want to have the right dose on hand that day for you. And we're running into problems with people that want to adjust their schedules and get rescheduled on a different day, et cetera. It's very important for people to understand how important it is to get back on that schedule on that day for us to continue to deliver vaccine efficiently and effectively for our entire community. So we really need people to make a commitment as they're signing up and getting scheduled for their first dose, to make sure that they're blocking their calendar and being ready to come back on that day, either 3 weeks or 4 weeks later, depending on which shot they get. And when the vaccine is administered, they will get the card that tells them which type of vaccine they got, and it will also identify on that card the day they need to come back for that second vaccination. So they have all that information right from the start, and they just need to plan to be available and to get back for getting that second dose on time.
Kevin, thanks very much for that detailed response. Just wondering, for people who didn't turn up for their second dose of vaccine, has there been any follow-up from the district to reach out to them to ask them to come and get vaccinated?
We are trying to work with those folks to reschedule, but the problem is that that takes our resources away from everything else that we need to do.
Thank you. And sorry, everybody, I just asked too many questions.
I had one more follow-up question about the long-term care facilities. Do you know exactly how many of those facilities didn't qualify under the federal guidelines?
I do not. I don't know if we have a comprehensive list to know that, but I'll ask Scott to look into that and provide some follow-up info. I think it was a fairly small number out of the total population.
Hi, Kevin. This is Ben Marjat with News 4. I have a question in regards to if you guys have an estimate as to how many or what percentage of the population might have some kind of immunity when we're talking about, 7% of Nevadans vaccinated, close to 9% of the population with a confirmed case at some point, and then you guys did the antibody study last summer showing, that the true number of cases could be 4 to 5 times higher. So with all of those three factors added together, do you guys have a guess as to what percentage of the population has some kind of immunity?
I think it's really tough to guess on that, Ben. As far as the number of people vaccinated, the Washoe County Health District alone has administered, I think, almost 24,000 doses just through our own pods, and over 7,500 of those are the second doses. So just from Washoe County, that's the number we know have gotten the second dose, and so within 2 weeks should have that immunity. The problem with relying on the number of both confirmed cases that we have, which is 41, sorry, I got to get my glasses on here, 41,491 as of yesterday, and of those additional cases that may have not been detected. We don't really know what that, how many more cases people didn't get tested for. When we did our antibody test, the serology test earlier in the year, that was after a period where there was some real limitations in the availability of testing. And so I would hope that more people have had the test available to them, and so that the number is not 4 times as many as the number of cases that we had confirmed at this point. And the other factor is that even if somebody did have COVID-19, we don't know how well they developed the antibodies and how well protected they are. And some of the indicators that we've seen is that if people had a mild case or were asymptomatic, they may not have a very good defense mechanism in place to prevent them from getting it again. And so I think we really need to rely on, for the most part, the population that we have vaccinated to really have some assurance of the immunity that they have, that the vaccination provides for them.
So just to follow up on that, you don't think that these relatively lower case numbers that we've been seeing are due to some degree of low level of herd immunity in the county? We're not at that level yet.
I don't think that the science would support that yet, Ben. I think that it's really more attributable to the behaviors that we're seeing, and what we're seeing is kind of a correspondence to, as the governor set up additional mitigation measures with first the stay at home for Nevada order, and then the pause for the reduced occupancy levels and the reduced levels for public gatherings. I think that those have made some significant impacts with seeing the decline that we've achieved.
Thank you.
Kevin, this is Siobhan with the RGJ. Are you tracking how many, I think we've had one confirmed case of people who've had COVID before and have it again. And then also, are you tracking people who've been vaccinated who may also contract COVID? Are those things you're tracking?
We are working with the Nevada State Public Health Lab in looking at potential reinfection cases. But I don't know that we're going to be able to identify all of those. But we do have our eye out for those. And then I'm afraid I don't have the answer for exactly where we are with trying to look at cases where people have been vaccinated. If that's reported to us, then we would capture that information. But I don't know that we have a mechanism in place to be able to automatically flag that unless it's identified through a disease investigation.
And then with the cases of multi-inflammatory syndrome that we've had here recently, were all those cases of kids, they had come in and been tested positive, or was it later traced to that they had COVID before, or did they all present at one point and get tested and were officially COVID positive?
I can't answer that for you for certain. I can have Scott follow up, but my understanding is that they had a confirmed positive for COVID-19 and then develop those symptoms. But we'll follow up with you on that, Siobhan.
Kevin, this is Kim Burrows from Channel 4. What do you recommend for people who have had either their first or their second dose of the vaccine about wearing masks and social distancing?
Thank you, Kim. That's a really important question. And what we recommend is that they continue to mask and social distance. And there's a couple of reasons for that. One is, while we know that the vaccine can prevent people from getting the disease, it is not known to prevent people from spreading the virus. And so they have the potential to still spread the virus to others, even though they've been vaccinated and therefore are not developing symptoms from that protection. So there's that risk of transmission. The other thing that we understand is that the efficacy of the two vaccines is around 95% in the original clinical trials. And with the amount of vaccine that we have in the community, that's not 100% protection. And so if we have a number of people that have 95% protection and they're out and intermingling with other people that could be spreading COVID-19, just by the percentages and the odds on that, some of those people are going to end up contracting COVID-19 even though they've been vaccinated. And so you should also be wearing a mask to protect yourself in case you've got that 5% risk of getting the vaccine from somebody else. And everybody needs to presume they've got a 5% risk of that. So it's a whole different situation when we've got all of this COVID spreading in our community and having the vaccine for COVID-19 than it is when we have virtually no measles in our community and everyone's vaccinated for measles. So even though the measles is not 100% effective and it's in the 90s as well for its efficacy, since we have such a low chance of encountering measles and people have that protection, it's very effective for preventing the spread. But with the high levels of COVID-19 that we have, it's very important for people to continue wearing masks to prevent them from getting it, even if they've been vaccinated, and to prevent spreading it to others.
Thank you.
This is Siobhan again. How long do you think we're going to be wearing masks, or that they'll be, or how long are you going to, and I'm sure that you can't guess, you don't have a crystal ball. How long are you going to wear a mask in public?
I am going to wear a mask until we're telling people that we don't think they need to wear masks anymore. And I don't know when that's going to be, but I think it's going to be a while. And so I think we're talking probably at the very earliest, I'm thinking it would be late summer that we would be telling people that. But we don't know what's happening with the variants. And so I would plan on wearing the mask for a while and try not to set an end date on it, so you're not disappointed if you're still wearing a mask past then.
Are you happy though that like flu is down everywhere because of masks? Do you think there's, right, we've had one flu death, right, in Northern Nevada? Is that such a low rate?
Absolutely, Siobhan. It's a relief that we haven't seen an active, vigorous flu season this year, because that would have just compounded our problems with the COVID-19 and with the demands on our healthcare system.
Kevin, this is.
I know that the federal government and CVS is working with long-term care facilities, but do you have any data on how that rollout is going in Washoe County?
We have limited data on that. I would refer that to the state if they have better information to provide for you. But that's kind of going down a separate path from the health district and the county operations, and so we don't have a lot of information on it.
Okay, thank you. And just as a follow-up, can you comment on, I guess, how low flu rates are this year compared to last year?
Well, they're much lower. We do have a weekly influenza report that's posted on our website, and you can see on there some graphical representations of where we've been in past years versus where we're at this year, and you'll see that we're very low levels compared to the past several years.
Kevin, this is Ben Marjat with News 4 again. I wanted to circle back on the fact that only 11% of the vaccines have gone to the Hispanic and Latino community. Are you guys doing any sort of, I know there's Spanish language advertising for like Mask On, Move On and those types of things, but any specific outreach to those communities in regard to the vaccine?
Yeah, I don't know if Scott wants to comment on that. I know we're working to expand the Mask On, Move On campaign. There's Scott.
Yeah, Ben, that's a great point. We have someone who helps us out with our Hispanic outreach. We're focusing on transitioning the Mask On, Move On campaign to a more of a vaccine campaign, and those discussions are underway. But we just continue to push out our press releases in Spanish. We have if you go to covid19washoe.com/espanol, it's not just a Google translated website. It's actually content that is designed for Spanish, and the whole basic components of that site were designed in Spanish. So those are our main operations with reaching the Hispanic community. But the Mask On, Move On campaign has been extremely successful for that community, and we have Spanish language social media channels that we're going to continue to use throughout this pandemic, and we're really hoping in the next week or so we can start transitioning that content to more pro-vaccine kind of content.
And if I could follow on to that as well, Ben, while Scott and his team are working on messaging for Washoe County, the state of Nevada made the decision to provide the federal funding for the outreach and communications regarding the vaccine to Immunize Nevada, which is a statewide great immunization organization. And so they have the bulk of the funds for the outreach, and they're kind of taking the lead on the outreach and marketing around immunizations.
Gotcha. And then how close are we just to moving down the next group of essential workers? Obviously, we're doing all the educators right now. How close are we to moving on to the next phase of that?
Well, we're real focused on the educators right now. So we're gonna have about 2,600 of the school district staff coming through our pod on Friday afternoon, evening, and Saturday, so that we can accommodate keeping the schools open and not vaccinating them during school hours. And we also have some of our fire partners engaged in working with the school pods for vaccinations as well. The next step beyond that is wrapping up with the frontline higher education staff from Nevada System of Higher Education, UNR, and TMCC. And then from there, we move to other frontline community support for our neediest populations. So some of the shelter personnel, food banks, and other of those support organizations, human services folks that are directly interacting and supporting that community are the next tier. And as a reminder, we provide the information on the COVID-19 vaccination website that people can see if they look at the lanes, the drop-down list of types of essential employers. It'll underline ones that we're currently vaccinating, and you can see where you may be coming up in the other essential workforce below those.
Hey, this is Lucia, and building off that question, do you know how many educators in Washoe County have been vaccinated out of how many there are?
I don't have that number on hand. I don't know if Scott has anything on that, but I think we can track down a number for you.
Yes, go ahead and send me an email, Lucia. And then the others who had questions, please send me an email and I can do some follow-up and get you the answers to that. And I'll put my email in the chat.
Thank you.
Any other questions for Kevin?
Actually, I had one. Hi, Terrell Wilkins from the RGJ. I had one quick question. I know last Friday, Johnson & Johnson announced their single-shot vaccine reached phase 3, and they said they intend to file for emergency use authorization sometime in early February. I was wondering if, I know it hasn't gone through the steps yet to get to us, but I was wondering if that vaccine kind of makes it through trials and gets to Nevada, if that would change the timelines at all for vaccinations. I know we only have the 2 vaccines so far right now.
Yeah, thanks for that question, Terrell. It should accelerate the timeline because, as we talked about with both the Pfizer and the Moderna, we have to do the 2-step with getting the first dose in the arm and then waiting for that booster shot. With the Johnson & Johnson, it's 1 shot, so that would basically double our efficiency in getting numbers of people vaccinated with that vaccine if we only have to have them come through once and we only have to use 1 syringe with one of our nurses to do that shot.
Gotcha. And I know that this particular vaccine is apparently somewhere around 66% effective. I think they said 72% in the United States specifically. Does that difference between the 72% and the 95% for the 2 vaccines that we have now, how significant is that, I guess, in people getting that single shot and having to wait? I think it's 28 days until it reaches that percentage. So how significant of a difference is that? And should people kind of weigh their options and try to get one over the other, or would that matter if that becomes a possibility?
So I don't think we want people trying to vaccine shop because we're still going to have limited supply and we're going to want to get the vaccine in as many arms as possible. And so I think what's important to understand about the Johnson & Johnson vaccine, Terrell, is that while it may be 72% effective here in the US as far as people not getting any symptoms of COVID-19, it's got very high efficacy of people not becoming severely ill, hospitalized, and dying. And so it's changing COVID-19 from a life-threatening disease to something that if you do get it, is not going to make you that sick. And so it's still a very, very important vaccine for us to have to protect ourselves from COVID-19.
Got it. Thank you.
Any other questions for Kevin? Okay, and one little update that the state issued today, they put vaccine data on their COVID-19 dashboard, and specifically to Shadidi's question regarding the terminology for vaccines completed, initiated, and administered, there's a learn more button on that dashboard under the vaccine tab that explains what exactly that terminology means. This meeting was recorded, so we'll put it on the COVID-19washoe.com website here soon if you want to watch this meeting or any past meetings. If you have any other questions in the meantime, we'll also have Jim English, our operations sector chief for the COVID response on tomorrow's 11 a.m. briefing. Thank you very much for your time. Have a great day.
Thank you, guys.